Hey everyone! Today we're diving deep into a health concern that's affecting millions worldwide, fatty liver disease. Now you might not have heard much about it, but it's a silent epidemic that deserves our attention. In simple terms, fatty liver is exactly what it sounds like, when fat builds up in your liver. This buildup can lead to inflammation, scarring, and even liver failure in severe cases. The craziest part? It often comes with no noticeable symptoms in the early stages. So the big question is, what causes a fatty liver in the first place? Let's find out. You're probably thinking, my shoulder? What does that have to do with my liver? It's a question that might seem odd at first glance, but the connection between these two parts of your body is more significant than you might think. It seems random, I know, but trust me on this one. The human body is a complex network of systems that are intricately connected in ways we are still discovering. You see, your liver sits on the right side of your body, right up under your rib cage. It's one of the largest organs in your body and plays a crucial role in detoxifying your blood, producing bile for digestion, and storing energy in the form of glycogen. When fat starts to accumulate, your liver gets bigger, and that can actually put pressure on the nerves that run from your liver all the way up to your right shoulder. These nerves, known as the phrenic nerves, are responsible for transmitting signals between your liver and your shoulder. Think of it like this. Imagine your liver is a balloon slowly inflating inside your body. As it expands, it doesn't just sit there quietly. It starts to encroach on the space of other organs and tissues. As it gets bigger, it starts pushing against everything around it, including those nerves. This pressure can lead to a variety of symptoms, one of which is pain in your right shoulder. That pressure on the nerves is what can cause that nagging pain in your right shoulder. It's a type of referred pain, where the discomfort is felt in a different location from the actual source of the problem. Now, I'm not saying that every shoulder pain means you have a fatty liver. Shoulder pain can be caused by a multitude of issues, ranging from muscle strain to arthritis. But if you've been experiencing persistent, unexplained right shoulder pain, especially if it's accompanied by other symptoms we're going to talk about, it's definitely worth getting your liver checked out. Other symptoms of a fatty liver can include fatigue, abdominal discomfort, and even jaundice in more severe cases. Fatigue is often one of the first signs people notice. You might feel unusually tired even after a full night's sleep. Abdominal discomfort can range from a dull ache to a more pronounced pain, often in the upper right side of your abdomen. Jaundice, which is the yellowing of the skin and eyes, indicates a more advanced stage of liver disease and should be addressed immediately. If you notice any of these symptoms, it's crucial to consult with a healthcare professional. Diagnosing a fatty liver typically involves a combination of blood tests, imaging studies like an ultrasound, and sometimes a liver biopsy. Early detection and lifestyle changes can make a significant difference in managing the condition. Lifestyle changes, such as adopting a healthy diet, regular exercise, and avoiding excessive alcohol, can help reduce liver fat and improve overall liver health. Remember, your liver is resilient and can recover if given the right care. So, if you're dealing with unexplained right shoulder pain, don't just brush it off. It might be your body's way of telling you to pay attention to your liver. Taking action now can lead to better health and prevent more serious issues down the road. Okay, we've all heard about belly fat, right? It's that extra weight around your midsection that seems impossible to get rid of. It's that stubborn fat that seems to cling on no matter how many crunches you do. You might spend hours at the gym, sweating it out, doing endless sit-ups and planks, but that belly fat just won't budge. But here's the thing. Belly fat is more than just a cosmetic concern. It's not just about how you look in the mirror or how your clothes fit. There's a deeper, more serious issue at play here. It's a red flag that something might be off with your metabolic health, and it's strongly linked to fatty liver disease. When you have excess belly fat, it can be an indicator that your body is struggling to process and store energy properly. Think of your body like a factory, and your liver is the main processing plant. Your liver is responsible for breaking down nutrients, detoxifying harmful substances, and managing your energy stores. When you consume more sugar and processed foods than your body can handle, your liver gets overloaded. It's like trying to run a factory at double capacity without any extra workers or machinery. It starts storing the excess energy as fat, and guess where it loves to deposit that fat? Right around your midsection. This is because the liver is located near the abdomen, making it a convenient storage spot. You got it, around your midsection. This type of fat is known as visceral fat, and it's particularly dangerous because it surrounds your internal organs. So, if you're noticing an increase in belly fat, especially if it's coming on quickly, it's time to pay attention. Rapid weight gain in this area can be a sign that your liver and metabolic health are in trouble. It could be a sign that your liver is crying out for help. Symptoms like fatigue, weakness, and even jaundice can accompany liver distress. So, don't just brush off that extra belly fat as a minor inconvenience. It's your body's way of telling you that something needs to change. The good news is, you can take steps to improve your liver health and reduce belly fat. Start by adopting a balanced diet rich in whole foods like fruits, vegetables, lean proteins, and healthy fats. Cut back on sugar and processed foods, and make sure to stay hydrated. Regular physical activity is also crucial. Aim for at least 30 minutes of moderate exercise most days of the week. This can include activities like walking, jogging, cycling, or even yoga. Don't forget about stress management. High stress levels can contribute to weight gain and poor liver health. Practice relaxation techniques like meditation, deep breathing, or even just taking time to unwind with a good book or a hobby you enjoy. Finally, make sure to have regular checkups with your healthcare provider. They can monitor your liver health and provide personalized advice to help you stay on track. By making these positive lifestyle changes, you can improve your liver health, reduce belly fat, and feel better overall. Remember, your health is worth the effort. Take care of your body, and it will take care of you. Now, this one might sound a little strange, but bear with me. Costochondritis, it's a big word, but it basically means inflammation of the cartilage that connects your ribs to your breastbone. And you know what can cause that inflammation? You guessed it, a struggling liver. Remember how we talked about the liver getting enlarged when it's full of fat? Well, that enlargement can put pressure on your diaphragm, the muscle that helps you breathe, which sits right below your lungs. And guess what's right above your diaphragm? Your ribs. So when your diaphragm is pushed upwards because of your enlarged liver, it can irritate the cartilage in your rib cage, leading to that sharp stabbing pain that feels a lot like a heart attack. It's scary, but it could be a sign of a fatty liver acting up. Have you ever noticed those tiny red spidery veins on your skin? They might seem like just a cosmetic issue, but there's more to them than meets the eye. They're called spider veins or angiomas, and while they're usually harmless, they can sometimes be a sign of something more serious going on beneath the surface, like liver damage. It's important to understand what these little red flags might be trying to tell us about our overall health. Now, our liver is like the body's main filtration system, right? It plays a crucial role in keeping us healthy by processing everything we consume, from food to medications. It helps to filter out toxins and regulate hormones. This organ is constantly working to ensure that harmful substances are removed from our bloodstream, maintaining a delicate balance within our bodies. But when it's overloaded with fat and struggling to function properly, those toxins can start to build up in the bloodstream. This can happen due to various reasons, such as poor diet, excessive alcohol consumption, or certain medical conditions. This buildup can damage the delicate blood vessels under our skin, causing them to dilate and become visible as spider veins. These tiny vessels are more than just a surface issue. They can be a window into what's happening inside our bodies. And here's another connection. A struggling liver can also lead to high estrogen levels in both men and women. Estrogen is a hormone that, in excess, can have various effects on the body. Estrogen is a hormone that, in excess, can weaken blood vessel walls, making them more prone to forming those telltale spider veins. This hormonal imbalance can be a result of liver dysfunction, as the liver is responsible for breaking down and regulating hormones in the body. So what can we do to support our liver and potentially reduce the appearance of spider veins? Making lifestyle changes, such as adopting a healthy diet, reducing alcohol intake, and maintaining a healthy weight can make a significant difference. Regular exercise is also beneficial for liver health. Physical activity helps to improve circulation, reduce fat buildup, and support overall liver function. It's also important to have regular medical checkups to monitor liver health, especially if you notice an increase in spider veins or other symptoms that could indicate liver issues. Incorporating liver-friendly foods into your diet, such as leafy greens, garlic, and turmeric, can provide essential nutrients that support liver function and overall health. Managing stress is another crucial aspect. Chronic stress can negatively impact liver health, so incorporating relaxation techniques like meditation, yoga, or deep breathing exercises can be beneficial. Remember, the liver has an incredible ability to regenerate and heal itself if given the right support. By making conscious choices to support liver health, we can improve our overall well-being and potentially reduce the appearance of spider veins. So next time you notice those tiny, red, spidery veins on your skin, take a moment to consider what they might be telling you about your liver health. It's always better to be proactive and take steps to support this vital organ. After all, a healthy liver contributes to a healthier, happier life. Take care of your liver, and it will take care of you. Let's talk about a topic that can be a bit embarrassing for men. Man boobs, or gynecomastia. It's more common than you might think and can be a real blow to a guy's self-esteem. But beyond the cosmetic concerns, gynecomastia can actually be a sign of a deeper issue, a hormonal imbalance, often linked to a fatty liver. Remember how we talked about the liver's role in regulating hormones? Well, when your liver is busy dealing with excess fat, it can't always keep up with its other duties like balancing out your hormones. This can lead to a decrease in testosterone, the male hormone, and an increase in estrogen, the female hormone. And one of the side effects of this hormonal shift can be the development of breast tissue in men. Now, you might be surprised to learn that your liver health can actually show up in your feet, specifically your right foot. Swelling in the feet, known as edema, is a common symptom of many conditions, but it can also be a sign of liver trouble. Here's the connection. Your liver plays a crucial role in producing albumin, a protein that helps keep fluid in your bloodstream. When your liver is damaged, it can't produce enough albumin, causing fluid to leak out of your blood vessels and into surrounding tissues, leading to swelling. And because of the way our circulatory system works, this swelling often shows up first in our extremities, like our feet and ankles, particularly on the right side due to the liver's location. We've all experienced that annoying itch that just won't go away, right? But what if I told you that persistent itching, especially on your hands and feet, could be a sign of a liver issue? It sounds strange, but it all comes down to bile. Bile is a fluid produced by your liver that helps digest fats. When you have a fatty liver, it can block the flow of bile, causing it to build up in your bloodstream. This buildup of bile can irritate your skin, leading to intense itching, especially on your hands and feet. It's called cholestatic pruritus, and it's one of those lesser-known symptoms of liver dysfunction that you definitely don't want to ignore. Let's talk about the thyroid, that butterfly-shaped gland in your neck that plays a vital role in regulating your metabolism. You might be wondering what the thyroid has to do with your liver. Well, it turns out they're more connected than you might think. Hypothyroidism, or an underactive thyroid, can sometimes be a sign of an underlying liver issue. Here's why. Your liver is responsible for converting the inactive form of thyroid hormone, T4, into its active form, T3. When your liver is struggling, it can't perform this conversion effectively, leading to low levels of active thyroid hormone in your body. This can manifest as symptoms like fatigue, weight gain, depression, and even hair loss. If you've noticed any of the signs we've discussed, don't panic, but don't ignore them either. Your liver is an incredibly resilient organ, and with the right care, it has an amazing ability to heal and regenerate. The first step is to talk to your doctor. They can run some simple tests, including a liver function test and an ultrasound, to get a clearer picture of your liver health. Remember, early detection is key when it comes to treating fatty liver disease. If you found this video helpful, please like, comment, and subscribe for more health tips and information.